Hello, this is Shahid Reyes. This is CVI 2018 from Denver, Colorado. With me is Dr. Updesh Bedi. He's an interventional cardiologist from St. Paul, Minnesota. Welcome, Dr. Updesh.
Thank you.
So you are number one. Congratulations for being a finalist for the structural heart challenging cases, and you are going to be giving the final presentation this afternoon. But can you tell us briefly about the case?
Yeah, so this is a very interesting case. This is, as you know, in St. Paul, Minnesota, we have a lot of Somali immigrant population, and this was a young woman, 25-year-old, who came to my clinic presenting with dyspnea exertion. And she had started these symptoms around when she was 15 years old, and now it had progressed to the point where she could hardly walk 10 feet before. So on examination, she had a loud systolic murmur, palpable thrill, and what we did was we did an echocardiogram. And the echocardiogram demonstrated severe pulmonary stenosis, right ventricular hypertrophy, some moderate RV dilatation. So because her peak gradient across the pulmonary stenosis, across the pulmonary valve was 87 millimeters of mercury, we decided to do a cardiac MRI, did the whole workup, and proceeded with a pulmonary valvotomy on this patient.
How was your approach in terms of heart team approach involving the surgeon? How was your discussion?
So we involved the surgeons, we talked to the surgeons about, but the thing is that pulmonary valvotomy is the treatment of choice for the right-sided, because of a young age and everything, any kind of valve on the right side would not be successful. She was only 25, even if you change the valve out at that age, she'll last till 35. So pulmonary, and the long-term outcomes for pulmonary valvotomy are excellent. Right, so as a result of which we decided to proceed with.
So how was your strategy, balloon size and access and that?
So access is venous access, right groin access. We had two accesses, one for the rapid pacing, the other one for the valvotomy itself. We choose the sizing of the balloon is based on the annulus size. So we chose, depending upon the kind of valve it is, in her it was a congenital pulmonary stenosis. So as a result of which generally the recommendation is to have the balloon to annulus size of 1.2 in these cases. So her annulus was about 16 millimeters, and we decided to go with a 20 millimeter Z-med balloon because of that scenario. We did that sizing both by echocardiogram as well as confirmed with cardiac MRI.
Nice. And the procedure usually, as you said, venous access, simple, rapid pacing.
Rapid pacing, cross the valve, do a RV-gram, make sure where the valve is. Once the wire is crossed, do another RV-gram because the anatomy can change. See exactly where you're going to do. In her case, we chose a 40 millimeter length balloon. You don't want to choose too long because then you can injure the PA. You don't want to be too short because then you are kind of trying to fight it. See the waist, go up slow. See the waist. Once you confirm that the waist is in the center, go up all the way.
And how did she do?
She did great. I've been following her for 2 years now.
Oh, really?
Yeah. So she started. She couldn't walk 10 feet. Now she started a job at Walmart.
Nice.
She works. She was on disability. She's no longer. She's the happiest person. She's like, you returned my life to me.
Yeah,
right?
it's like 25 years old. It's
25 years old, exactly.
And that's great. I mean, good luck for your presentation today.
Thank you.
And I hope your result will be in favor. How about shifting gears? This is your second or first time in CVI?
This is my first time in CVI.
What's your impression?
It's an excellent meeting. I think I think the organizers have done an amazing job. It's a case-based thing, and also I like the fact that they are giving early career members and they're giving fellows a lot of chance to kind of proceed forth, and that is really good.
Absolutely,
excellent.
This is one of the highlights, and this is I think that if you talk to them, the vision is to give more podium time to early career and trainees.
Exactly,
which is we miss from other meetings.
Well,
thank you so much for your time. Congratulations again for being a finalist. Please watch this video and also Dr. Bedi case on the YouTube channel as well as the CVI website. This is Shahid Reyes from Denver, Colorado. Thank you.
All right, thank you.